dias, família. Oh, I got that right. Good. My name is Carlson. Yeah, I'm the CEO of Odyssey House in New Orleans, Louisiana. And if it's all right with you guys, I might move around a little bit because I don't know about you, but after lunch I feel a little tired. I feel like I want to take a siesta. Odyssey House, we're the largest addiction treatment provider in the state of Louisiana, treating over 25,000 people a year on average. We have sorry. There we go. Yes, so we're the largest addiction treatment. We've been around for 50 years. We have a very, not necessarily unique, but we've been very pioneering in this sort of combining primary care, mental health, and substance abuse treatment services, all in an integrated fashion, but primarily pushing with the force and the idea of addiction treatment. We started out as a traditional therapeutic community, TC, for many years, and then we have modified and changed a little bit over time. So I'm going to talk a little bit about the past, the present, and where the future of TCs are going from a global perspective. I've had the opportunity to travel around the world. I've actually been working in the field for close to 40 years. I've had the pleasure and the honor of being able to listen to people like George Leon, Rod Mullen, Dr. Taylor, and a lot of people up here like Fabian, people from all over the world who have been working and pioneering to provide addiction treatments to people. And it's very, very important. So just a quick recap of where we came from. So first of all, in the 1940s, we kind of started off really in England. The first term therapeutic communities came out. And we started to see that the model started to come up and develop, and people were studying and trying to look for ways to deal with mental health issues in particular. But it sort of became a natural component for addiction treatment. In the 1950s, the TC model started to develop in the United States. And then there were definitely some groups like Synanon and Daytop that were starting to pioneer the idea of treatment and treatment services. A lot of these organizations, or some organizations, they were developing over time, especially around the world, in some parts of the United States, had much more of a religious base to it, coming from either church base or another religious base, because people were trying to deal with the issues and problems that people had. In the 1970s, what sort of adds and helps and creates complications, money started to become available, right, in the United States. In the mid-1960s and 70s, the federal government started to put a lot of money in the U.S., countries around the world started to put money into treatment for addiction and addiction treatment services. And so the TC approach seemed to be sort of making a lot of the logical senses at that time. So how did they spread globally? And so a lot of this has to do with institutionalization, people institutionalizing the treatment and treatment services. And conferences like this, where people started to share ideas and ways that they were looking at trying to provide services. And everybody was looking at trying to figure out how to deal with the addicted population in particular. And there were a lot of religious leaders who were looking to help, to serve the poor and the people who have been disenfranchised and are not cared for, who are suffering from addiction, from alcohol or drug addiction. So in the 1990s, some of the early models, the TC field started to sort of change, and actually it was a lot of looking at sometimes TCs were not considered medical based or didn't really work well within the medical system. But that has actually changed. So evidence-based practices started to be incorporated, like cognitive behavioral therapy or other types of therapies and other work to sort of really help to sort of modify. And then as the medical field started to develop in 2000 and up to the present, there's been more and more medications that have helped people with cravings, addiction, and then also looking at how we might be able to sort of deal with some of the issues and problems that people are suffering with, besides necessarily their addiction issues. So as you can see, spreading globally, all throughout the continents, and so everywhere in the United States, the United Kingdom, in Europe, in Asia, Australia, Latin America, and also in Africa, there's been a lot of development over time as things have been changing and people started looking for ways to be able to provide services to the addicted population. So we'll talk a little bit about today. TCs today. So a lot of them, it's very interesting because I have actually visited programs where they had all of the elements of a TC, but they didn't call themselves a TC. It's fascinating because some things sort of develop sort of a natural process in terms of how they're focusing on dealing, what's created in the community. Things like peer support, group therapy and counseling, community living, emphasis on personal responsibility and self-reflection, rebuilding and working with the goals of how rebuilding self-esteem, developing healthy social skills, and support long-term recovery. So key characteristics of a therapeutic community. Obviously, holistic treatment. We're looking at treating the whole individual. Group-based therapy, encounter groups, ways to sort of help people to focus on dealing with changing some of their behaviors. Therapeutic environment. The environment becomes structured, basically helps to include, groups, discussions, individual therapy, and different activities that help people to develop their self-esteem, but also what I like to call is life skills, right? Somehow, a lot of people get caught up in the addiction, and their addiction, they lose sort of the concept that maybe they never had that, about having some basic life skills. And the staff play an important role in this process and how we're supposed to be working and changing and helping to show as role models for the clients and how they interact in the work that they should be doing. Now, one of the things is length of stay has changed. When I started at Odyssey House in 2005, we were an 18-month program. And when we would have a graduation, it was like a big deal, because it took time for people to graduate. But government funding and things have changed a lot. In fact, the state of Louisiana doesn't even want us to talk about the therapeutic community concept. So what we have is housing with intensive outpatient services. And so you can walk into it, it would look like any other TC, but they like the idea of separating that out. We're able to keep people for up to 6 to 7 months in that kind of a process to get funding. So a lot of the strengths and criticisms of the therapeutic community, a lot of the strengths, strong peer support, focus on long-term recovery and self-empowerment, proven success in reducing relapse rates for drug addiction. There's plenty of data and information that shows that what we do works. And so the thing is that you have to constantly be showing and sharing this information with your funders so they understand the work and things that you're doing. Some of the criticisms, concerns about authoritarianism or recursive practices in some early TCs, potential of a groupthink and emotional manipulation. And also, some of the critics argue that TCs may not be suitable for all patients, especially those with severe mental illnesses or trauma. So you have to sort of think about the population of people that you're working with and how you can actually sort of meld them into the therapeutic community, but also be able to work with them and people that have special issues. Today's changing TCs, there's a lot more clinical requirements. Diversification by necessity. Sometimes you have to diversify and look for special populations and special needs, and lack of a uniform curriculum. So some of the things we have to do is, we've been working a lot at Odyssey House, is how do we sort of work on creating a curriculum that helps us to move across all of our different programs. So like our Women and Children's program operates a little bit different than our male program does, for example. And we've had other specialty programs that we have been able to sort of incorporate into some of the services that we've been able to do. So clinical changes, so length of stay, which is a really important piece, because I do think that there's got to be a way to sort of extend out time. The biggest thing that's the key indicator of success is time. How long people are engaged in the treatment process. And with the TC, the longer we can keep people engaged, the more we can work with them, the more likely we're going to have better outcomes. Other clinical modifications and change, increasing the numbers of professional staff certification, recovery support staff, peer support staff. So we've been doing a lot of things about peer support and peer support training in the United States, which has been really great. It gives our clients who are graduates of our programs who want to come work in our program a way to sort of get a certificate so they can actually be able to connect and then do the work, and it helps them with their own process of treatment and recovery. Program accreditation and quality assurance. So at Odyssey House, we have a whole department dedicated to quality and compliance to make sure that we're providing the highest quality outcome and services in the work that we do. And we do this in such a way that we help to gather data and information and measure the things that we do and look at sort of the incidents that happen with our clients. What happens when length of stay is short or a client walks out and leaves? We look at if our length of stay, we know that they need more time in treatment. If they leave early, we know we haven't done them any benefit, or we haven't done any benefit for ourselves. Diversification. So a lot of the community-based programs are very diversified now, and it looks for different ways to sort of help them meld in many different populations. But also it's important, and sometimes some programs need to be set aside for really specific people, specific groups, as I mentioned, women and children's services, for example. So we have some shifts from our TC roots. Our approach has mostly been taught through oral tradition, but more and more, especially as like some of the writings, George, DeLeon, the work and services for a lot of the people who are up here, and a lot of the writings that we have, as you've heard from a lot of the people that are from all over the world here, that are sharing a lot of the writings, data, information, creating ethics. Is all of these things is a movement in the field as we're sort of helping to sort of define and give guidance for people as we sort of develop programs around the world. So one of the things is we need to have much more uniformity. And I know that George talks about sort of like adhering to the method, focusing on the core essence of the important things that you have to be successful, that gives you the best outcomes ever. And in a lot of his writings, and he's going to talk a lot about this when he gets an opportunity to speak, it really sort of hits core to the work that we're doing. So the future of the TCs. So how TCs can adapt. So I think one of the things, there's a lot of stuff that's happening with technology, everything from virtual hybrid therapeutic communities. A lot of our clients, they're all creating groups, a lot of our graduates, groups online, either through Instagram, Facebook, TikTok, you name it. They all seem to be doing things that are focusing on supporting each other in their recovery. Digital health tools, we actually, in our long-term program, at first we didn't let people have their phones, right, because it was a distraction. Now we actually let them use their phones, and we actually try to create some ways to help them have some good, positive ways of being able to utilize their phone in the right way so they can make their appointments, use it to find jobs. We give them access to the internet so that way they can be able to find the things that they need, communicating with people out and about, also sharing the information about their change. Online communities, more and more, there's a lot of development in online communities. We were actually involved in a study that we had. It was a 3-year study where we actually created an online community for all of our clients. We gave them all tablets, and they were able to sort of connect with people online, and when they graduated, they still were able to connect with people in various different stages of their recovery process. It was very fascinating. Some of the outcomes were very supportive. It gives people sort of a supportive environment in different ways. So there's a lot of things that are happening that are probably change. AI and personalized treatment plans, and how we can use artificial intelligence as a way to help support the work that we're doing, streamline some of the work that counselors have to do in requirements for paperwork. It just seems the amount. It gets more and more and more every day. There's got to be a way to sort of streamline things to make things work better for everyone. So some of the current trends. So integration with modern psychotherapy, utilizing therapy. Now, one of the things that I think is always important, if you're going to use any kind of curriculum, anything that you're working on, or anything in relation to primary care services, mental health services, and addiction treatment services, you do it through the therapeutic community lens. What is the process, and how is this going to help to support the work that we're doing? And how are we going to help to move people forward in an integrated approach? In the olden days, we used to be like somebody came in and had a mental health issue, we sent them to the mental health clinic down the street. Now we own the mental health clinic, right? And so the mental health clinic staff are trained to be able to provide the services, and they understand the model, the work that we're doing, and what are the right things that are important for everyone. Focus on holistic healing, incorporating things like wellness, everything from yoga to Tai Chi, things that you can help to sort of get people to be more focused on their bodies, their physical bodies, and healing themselves through the individual process. Eating right? Eating correctly, not eating a lot of garbage food, helping them to learn how to sort of live their lives in the right way. Expanding to diverse populations, making sure everyone's feeling included and added and connected in. And emphasis on peer support. What are the things that we can do to help with peer support? Because peer support, we know, is one of the key indicators that helps people as they're all moving together and helping them to change their behavior and moving the behavior in the right way that helps them to be able to be strong and work to help them to work on their recovery process. So the future of therapeutic communities, a lot of opportunities. Integration with social services, expanding into general health care, focus on prevention, intervention, and harm reduction. I always see it as almost treatment as like a part of this continuum. You can start off with, harm reduction methodologies, moving to prevention, intervention, and helping to move people as a way of connecting with them, getting them to feel comfortable, then moving them into treatment and treatment services. Diversity and cultural sensitivity, which I think is very important, that we have a good understanding of cultural needs and cultural services overall. And shifting societal attitudes and helping people, shifting societal attitudes around how we can get a better focus on getting people to be able to understand and reducing the stigma for addicts. We're working on some legislation that's coming, legislative session in Louisiana, about getting tax credits for businesses that hire people who graduate from a treatment program. So, but right now, for example, one of the things we have is we have a culinary arts program. If you don't know about New Orleans, Louisiana, we like to eat. Anybody who like to eat? I love to eat food. Good, healthy, crazy, nice, tasty food. Well, in Louisiana, it's like a passion, a way of life. But we train our clients. We have a whole culinary arts program. So we have a chef that teaches basic culinary arts skills. They get certifications, and they also get a certificate that they have to actually get from the state in order to be able to work in restaurants, etc. So we get them all of this information, and they're being hired like mad as they're graduating from the program. Restaurants are picking people up. They love our clients. They have a work ethic. They believe in what they're doing. They show up. They're sober. They're smart. They're focused on learning and adding to themselves. But in integration, expanding into a shifting attitudes is sort of like letting people know that just because somebody had a problem and they're coming out of treatment doesn't mean that they should be shunned by society. Society needs to be open to it. So we do a lot of advocacy work and educating society about these issues. And challenges to growth. Funding is always a big challenge. It's always been a big challenge. We'll have to continue to do that. But advocacy is an important part of this. Resistance to non-traditional approaches. So, coordinating and working with healthcare professionals. We have what we call the United States a federally qualified health center. So we have this health center that provides primary care services, and they're very similar to health centers all around the country, but ours is different because we focus on the idea of helping the addict to maintain and to keep their sobriety. And so we are always very focused, but it's with our lens of going through the therapeutic community and the treatment model. And also obviously working with social stigma and helping to reduce stigma. And also doing a lot of work to reduce regulatory barriers that can help to hinder the work that we're doing. Things that affect things like Nesta. So the importance of the World Federation. I just want to mention Brazil. We just finished the World Report, which you're going to hear about. But Brazil, you guys knocked it out of the park. We got more treatment programs from Brazil to participate in our survey. I only got 20 in the United States, which was embarrassing. We had about 250 from here in Brazil. So I know the work that we've been doing here in Brazil, you guys are doing is amazing. I think it's really great. But being a part of a group like the World Federation, if you get a chance, we have a table. We have you can also get information about the World Federation. I encourage you to join, be a part of what we're doing and what we're exchanging information from around the world. So that was our community sharing systems, world conferences, and our world social media, which probably is Thank you. I really appreciate the opportunity of being here. I love your country. It's the third time I've been here, and I really enjoyed it.